On this show, we've talked extensively about the health benefits of red light therapy on the body, but we've never really talked about how this impacts our dental health. Today, we're going to dive into that and so much more, so stay tuned. Welcome back, my friends. My name is Sarah. This is the Sarah Kleiner Wellness YouTube channel. And on today's episode, I have two dental professionals from the UK. We are going to be talking all about the mouth and red light therapy, as well as UV light therapy, how that can impact your dental health. Now, I will have links for the toothbrush that they are talking about here. I've been using it myself. I think it is absolutely fantastic, and it's going to change a lot of lives and a lot of the way that we look at our oral health in general. So please check out the show notes for the links to that toothbrush. They have it available in the United States as well as the rest of the world. And make sure to follow them over on Instagram. I will have their Instagram handle so that you can check out all of their new and exciting research when it comes to this topic on the oral microbiome, the health of your teeth and gums, and how we can use things like light therapy to enhance them and actually keep our mouth really super healthy without using things like fluoride and antiseptics. So again, check out all their information linked down in the show notes. And before we jump into today's episode, I want to thank really quickly a couple of sponsors. The first one is going to be VivaRays, and you can use my code YOGI to save 15% on any of their products. I'm a huge fan of their circadian glasses. I also use their eye mask and love their low EMF headphones. So if you're looking for something to listen to this show on, check out those low EMF headphones and use the code YOGI to save. The link is down in the show notes. Second sponsor of today's episode is Upgraded Formulas. They are my go-to source for protecting the mineral balance within my body. You can use my code YOGI12 or YOGI to save on any of their products, as well as that hair tissue mineral analysis with a consultation. Again, it's a lot easier to get a test to know what you need because minerals balance one another out. The basic mineral that people don't understand is sodium and potassium, how that ratio works. If you are over supplementing sodium, which most people are, your potassium is going to be very low, and that could lead to things like fatigue, muscle pain, weakness, and even thyroid concerns. So make sure to check out Upgraded Formulas, linked down in the show notes. And let's jump into today's episode, all about your mouth and light therapy. I'm so excited for you to listen. Hello, everyone. Welcome back to the show. I am so excited to have some wonderful gentlemen here. We're going to talk about oral health and a really interesting product that they've got and red light therapy. So let's take it away. If you both would just jump in and introduce yourselves to my audience.
So I'm Richard. I'm an orthodontist from the UK, and we, together with Flynn and I, have developed a red light toothbrush, and we've sort of come to that from a long path, which we'll probably get into at different stages. But I'm a dental professional.
Yeah, my name's Flynn. I'm going into my second year of dental school, and I'm a student. I'm interested in photobiomodulation, and basically I suffered from an autoimmune disease, and it's kind of led me down this path, and this is how we've kind of come to this product together.
Wow. So I love hearing personal stories of getting people to this kind of place with health. And we were just talking about that before I turned the camera on, of like, going down, knowing that allopathic medicine was not the way. And then you kind of go alternative medicine and you're like, getting warmer, but not quite there. And then we land into quantum biology and circadian biology and things like photobiomodulation. And it intuitively, I just feel like it makes so much more sense. You know what I mean?
Yeah.
Yeah. I mean, there's 20 years that separate us, but we've actually had very similar journeys and stories coming from very different angles. So just to give you a little bit of my background, I was the poster boy for a classic scientific education. So I came through all of the schools, did everything, followed the science in terms of what I was meant to do, from diet and exercise. Didn't smoke, didn't drink excessively outside of university, and we didn't do drugs or anything like that. I was literally the poster boy for that. And we were just talking about families, and after we had our first little boy, he was a non-sleeper, and that just really tipped me over the edge. It was at the same time that I sat my consultant exams in the UK. We relocated me out of a lovely bright office, which became his nursery, into this like shoebox style dark room that we eked out of the garage to do my revision for my final exams. And it was over a summer, and I sat my exams. It all went very well. And then the November time after that, I developed a really chronic cough, low grade, but it just kept on going and kept on going. And by the Christmas of that year, I was just a broken man. You know, I went from exercising 4 or 5 times a week, playing sports outside, you know, full-time job, young baby, you know, full of energy. And I could hardly tie my shoelaces. You know, I just really couldn't do anything. And that's really, it really hits you when something like that happens, when you go from what people would describe as the picture of health, which I now understand was definitely flawed, but you're there doing everything, and all of a sudden you're not. And you go from being, you know, a really important member of your family team to, you know, being someone who almost needs caring for, you know, in that environment. And so there are physical issues, but there are mental issues that go alongside that for sure. And we ended up being hospitalized and having several investigations. And my initial provisional diagnosis was lymphoma, which obviously pretty significant. It turns out it wasn't that, you know, and through a diagnosis of exclusion, they settled on an auto-inflammatory condition called adult Still's, which is a late onset juvenile arthritis. Now, most of my symptoms were fairly systemic anyway, you know, aches and pains, night sweats, all that type of thing. But I was good for nothing. I couldn't really do anything. So the only initial road to recovery and functioning, because we had another baby arriving in 2 months' time at this stage. Oh. And, you know, my wife is, you know, this big, and we've still got a toddler who doesn't sleep great. And the only recovery at that stage, the crutch that was available was the allopathic approach, which was corticosteroids and immune modulators, and the mixed bag of stuff that goes with that, bisphosphonates, calcium, you know, all that stuff. You know, I take this, so I need to have that to protect that, and that to protect that, and that to stop that happening. And I'm sure that will resonate with lots of people, because, you know, it's one medicine and then it's 6 medicines and you feel like you're rattling on a morning. But we got to a level where I could work, I could function, I could be a dad, you know, I could, you know, be a husband, you know, all those things. But you then are faced with the reality that that's maybe you forever. You need those bits to keep functioning, and you understand that the medication may be life shortening and may increase your risk of cancer and all those things. So I've always been fairly proactive. So you start looking into it yourself, Sarah, don't you?
Yeah.
So,
100%.
and you know, you're left with that. And I picked up, you know, low hanging fruit. Well, what about diet? Maybe we've got something wrong with the diet. So, you know, we were eating essentially a carb was the bit that the whole meal revolved around. So it was get the carb first and then put other bits in and around it. So we stepped away and we went down the sort of keto route just to try and lower that general inflammatory burden. And we saw some results. And then I get deeper into it, and a colleague introduced me to photobiomodulation. She was a pediatric dentist, and her angle was, well, is there an element that we could use for the immediate post-trauma recovery of teeth? And then the other side of it was, well, can we actually create analgesia with photobiomodulation, like an overload of it to numb the trigeminal nerve, and then actually be able to do needleless dentistry? So that was her angle. And I went on the course with my wife, and was really sort of taken back by the the level of biology that it actually interacted with. You know, I was reminded about mitochondria for the first time in about 10 years. And, you know, it really does, it gives you a shock. It's like, I knew this once, you know, I need to go back in and have a look at it. And there's evidence. I did the Thor course. Are you aware of James Carroll and the Thor products that they have? They're mainly UK, but they make the Nova Thor bed. You might have.
I haven't heard of that.
Yeah.
What kind of, is that like a PEMF bed or?
No, just a red light bed.
Okay.
Red. And it's used by a lot of the sports teams in the States and military. They're working on like a helmet for neurological trauma and chronic disease that way. And they have these handheld panels, and there are specific like dental bits that you add onto it to use in the mouth. So we did it that way. And then I went and bought a panel and I just started using it. And it was the first thing that I thought, right, this is actually making a difference. You can just feel it. Like you said, it just feels intuitively. I'm not as sore. I'm not as achy. So you carry on using it. And I find out about Gerald Pollack and the 4th phase of water. And I'm like, this is it. This is how it all connects together. And you start searching around. And at one point I was naive enough to think that I was making this connection. And then I remember going on to finding a podcast with this American dude with a beret on backwards and a metal chain sitting in his wine cellar. And it turned out to be Jack Kruse, talking about this. And I was just blown away by his, just his knowledge, and seamlessness in terms of being able to deliver that knowledge. And, that changes your life, doesn't it? When you're exposed to something like that. So that was really profound. And skip forward 10 years, I don't take any medication. I'm in better nick than I was at 30. I can do everything I want. I've got 2 active boys, an active life, a full job, all those things. And I realized that red light wasn't responsible for all of that, but it's the big picture. And it was one of the major crutches that I used to get well from that auto-inflammatory condition. And Flynn's story is a little bit similar from a different angle, isn't it?
Yeah, so it's pretty similar to a certain degree. Basically, as a child, I was always having really bad tonsillitis. I missed loads of primary school. And then from there, I had some like bowel issues, and I was always just more tired than all my colleagues, like always just needed more sleep. And I just couldn't seem to like keep up with everyone. But, I was always active. I was always like Rich was saying, I was always like poster boy of health. I was always on the cross country team, just trying to manage things. But one thing that was really bad was I used to get really bad mouth ulcers. And I was going to doctors all the time. They were telling me, first of all, it was iron deficiency. Then I was put on iron supplements. Next thing, it was, vitamin D. It was, you're stressed. You've got anxiety, all these different things. I was just palmed off, basically. And sometimes I'd have periods of remission and I'd be okay. And it was just something that I learned to deal with. And then throughout high school, I was okay. And then it got to, in UK, we have our final exams in year 13. So you're 17, 18 years of age. And basically, I was doing my A-level exams, which determined, if I could get into university. At this point, I was set on doing dentistry.
Although I tried to convince him against it.
I started it, and I was revising really, really hard. And at the time as well, I was rowing at a very high level. So I was training, looking back, it was ridiculous. I was training 2-3 times a day, 6 times a week, doing lots and lots of steady state. At this point, I had listened to Rich a little bit, and I was trying to bring the rowing machine outside in the cold and things like that. But I didn't understand why I was doing it. I was just, thought I'd give it a go. And then basically I finished my exams and I was very, very stressed. I had a bit of a breakdown. And I was had what I now know as a flare up, but back then I just thought, I'd got like sick and I was really stressed. So I didn't really recover from that. And obviously it was summer then and everyone was celebrating, more late nights, a bit more alcohol, not that I drank much anyway. And then it was the pandemic happened, COVID, I actually had a COVID vaccine, and a few other bits, but it just went downhill and downhill and downhill. So I took a year out. I didn't go to uni in that September. I took a year out and, set some time to try and help myself. Now, it's quite interesting, actually. I got diagnosed with an autoimmune disease called Behçet's. And basically, it's systemic inflammation affecting the blood vessels. One of the major symptoms is, mouth ulcers, headaches, joint pains, and, there's no medical evidence suggests why people get it, or, like most autoimmune diseases.
It's grim, really grim. Like we're not talking like little ulcers, we're talking like big ulcers in the oral cavity. It's really
wow.
Yeah, it wasn't very good. And, I got put on a medication called colchicine at first, which is used to treat gout, and it wasn't working. And then eventually they put me on azathioprine, which is an immunosuppressant. And at that point, I was seeing no improvement. I was actually getting worse. My hair was coming out. All my friends were at university and I was at home. I was really, really ill. And then it got to the point, and it was about January, February, and they said, right, we're going to have to put you on the next level of treatment, which is like biological agents. They said to me, you're going to be on these biological agents for the rest of your life, injecting yourself every 2 weeks, and hopefully you'll see some improvement. And they said, we're going to do some blood tests to get your levels right, and then we'll order these in. It'll take about a month to arrive. And in that month, I'd kind of listened to Rich for some parts, but when you're really ill, it's hard to understand the quantum biology world. It's a lot.
Yeah.
So what I did was actually, I went on holiday. I went to Tenerife by the equator. I got lots of UV. And at that point, I just went gluten-free. And I saw like a massive improvement. And by the time I got home, the injections had arrived. And I thought, you know what, I'm just going to give it some time and see if I can, stay off them for a little bit longer and see if I can help myself. And then as time went on, ended up going keto. I did all the, functional medicine parts of things, like paleo diet. I was taking tons and tons of supplements. And I got to the point where I was off medication and I was pretty much symptom free. But I knew something was missing. And then basically it's only recently that I've started getting into the quantum biology world. And it's got to
He's let the light in now, Sarah.
Yeah, I've let the light in.
I love it.
There was a point before I'd got really ill that Rich had found kind of like a prototype of using red light therapy in the mouth. And this is before I knew I had an autoimmune disease. And he gave it to me to try. And this is before I knew it was Behçet's. I just had oral ulceration. And obviously, Rich knew it was some kind of systemic inflammation going on. And I was using this red light therapy in my mouth. And I saw a massive improvement. So I knew in the back of my mind, when I started doing all the quantum biology stuff, I thought back to the time when I started using this red light in my mouth and realized, there's something here. And I think that's where it kind of has led us to this toothbrush we've got now.
That's where we are today. So that's a good catch up.
It's amazing. I mean, I love going back to the whole idea of the water, and the fourth phase of water, and Dr. Gerald Pollack's work, and what Dr. Kruse talks about, and how I feel like those of us that go on these health journeys, we go to the food and the food is helpful, but it's kind of just a step along the way. And then we go to, we would just keep going deeper. And I think we all kind of end up at water, like, what is it that's going to allow my mitochondria to make the most water? How do I coach this process? And then red light therapy is what comes, the photobiomodulation. And There's like over 6,000 studies on it right now. There's so much research being done and it's being used in so many different ways. I'd love to kind of hear how you came to, I know you did some work that you mentioned and some research, but kind of how you decided to come with this product and just more about it.
So we after introducing it in my world sort of systemically and seeing the improvements, you then you just want to build on that a little bit. And knowing that there were dental applications already, there were UK studies and international studies using photobiomodulation for oral mucositis, a post-radiation or chemotherapy induced condition, which is really, really debilitating, and is one of the main reasons that people stop their supportive or adjunctive cancer therapy, just because it's so painful. They can't eat, they're struggling to take liquids. So, the Thor team and other international entities were actually making some real headway with the science around this in conventional studies. And so it struck me that there was an obvious gap in the sense that my approach to dentistry, certainly in the last 5 years, has been very, very preventative focused. And I think that really is the best dentistry that you can interact with. So if there are things you can do on a day-to-day basis, and I'm sure your viewers, Sarah, will appreciate this because they're already the people that are looking at their diet and thinking about how that interacts with them as a whole. And the mouth is the gateway to that. So it's obviously very important. And were there strategies that you could potentially put in place to support that preventative stuff that you're already doing? That there aren't many people who aren't brushing their teeth. So if you can get additional benefit from that same process, then brilliant. And if we can knowing that the mucosa in the mouth and knowing that the gut, extrapolating it to that area, how sensitive it is to light, then there has to be an application there for this. And then seeing the studies coming through about how red light in particular was improving the experience of these cancer patients with their oral mucositis. And if it was used preventatively, so if it was used before the therapy was started, then it was almost making them more robust. They were able to then handle the treatment. And even if they got mucositis, for example, it wasn't the same grade as the people who perhaps had no intervention with red light in that example. So for me, there just had to be a product. And at that stage, I was all set on making my own. And then you do a bit of research and you find that there's really not much out there. And I stumbled across a guy called James, who is an American trained science grad, who is now working and living in South Korea. And he had a product and he had it up and running. So we've worked with him over the last few years to, evolve the product. And he's very receptive and he's very knowledgeable about the sort of the physics of the situation and the light. And then, of course, you've got to deal with the mechanics. We've got one of the brushes here, and I know that you've seen them before, Sarah.
Yes, you guys sent me one, and I've been using it. It's very interesting. Yes,
looks like a toothbrush, doesn't it? It's got to look like a toothbrush if people are going to use it, and it's got to be the right weight and size. And the head size is obviously important as well. And the head size initially dictates how many LEDs you can use, how much power you can get, and all that information. So we've settled on this as the current design for the product, but it's an evolution. We're learning. It's not like there's loads of other people trying to do the same thing. Yes, there are quite a few knockoffs on the market that are more aimed at whitening. Ours is the only one, and we hold the patent for the combination of the red and the UV
and the light delivery method.
Light delivery method, exactly. So this is where we're settled. And there's a few little bits about the brush that are sort of worth pointing out. Obviously, it's USB-C charged, which means that there's only a direct current in it. So that keeps things like flicker to an absolute minimum, because it's got a continuous current rather than that alternating, frequency that produces the flicker. And we incorporate 2 wavelengths of light in it. So it's got 635, which is similar to something like the EMR Tech red that they use in their panels. And we know the main aim of that is inflammation. So we're trying to target that inflammatory process around the superficial tissues, because we understand that red doesn't penetrate as well as a near infrared. Okay. But then again, a lot of the tissues that we're actually trying to hit are pretty superficial. Yeah. Okay. So we can make peace with that. And then the other part of it is the UV, and it's at 410. So it's below that melanopsin 435 to 465 window that we're all concerned about in the quantum world. But it is still sort of in that UVA range. Okay, so you perceive it as a purple, essentially. And you can have just purple, you can set it to do just red. And most people, and most of the time, it's going to be both, because you want a little bit of both. And the target with the UV is twofold, in the sense that because it is that slightly higher power from the shorter wavelength light, you get something called photolysis. And in the structure of the tooth is that you've got enamel on the outside, which is like the really tough outer coating of the tooth. And then inside of that, you've got a layer called dentine, which has these little tubules, like little connection pipes from the middle of the tooth, which is where the nerve and the blood supply all lives. And there's these little channels that run up and down them, and they can get products in them and break down products. And the concept of photolysis is that actually the light in the UV range can actually excite those breakdown products and essentially sort of implode them, essentially. So it breaks that down with the wavelength of light. So you do get a little bit of lightening. I would never claim that there's a whitening element. So that from this photolysis. And then the sort of the other side of that is, I believe that redox determines the color of your teeth.
Agree. And melanin too, I think. The amount of melanin we have.
This is new, the melanin bit to me. Like, I know about the embryology of teeth, but I just still like the POMC story.
So much. Yeah, there's a lot there.
So many
and I know he's been telling us about it for a while, but just sort of like, I can't even imagine, it's in there, but where is it? So all the dental tissues are neural crest derivatives. So we know that they've got the same basic building blocks as your skin and your brain and things. So it's got to be in there somewhere, but where's it expressed, and how's it expressed, and what impact? It's just, there's so much to learn. And it's so fascinating. But if you think from a redox perspective, if you think maybe that the color of the dentine, which is sort of a yellowy hue, I think if your redox is low, you can see that in someone's mouth, their teeth look darker. And it's not necessarily because they're not cleaning. It's just that they're less vital, they're less vibrant. It doesn't look like a well tooth. So if we assume that we are targeting and hitting some mitochondria, and we make the assumption that the light is transmitted into the tooth, because I don't have any research that says that it gets into the pulp of the tooth, but it certainly hits the periodontium. And all you need to do is hold this in your mouth and you can see it shining through your cheek. So you don't need to be a physicist to understand there's a bit of depth penetration there. But if this also works on the mitochondria, and it's helping to build a little bit of redox in those tissues, well, maybe you get a bit of a lightning effect from that as well, or a bit more vitality in the way it looks.
I hope you're enjoying today's episode. As a reminder, make sure to check out the links to follow today's guests down in the show notes. And the link to the toothbrush is also going to be down there in the show notes. I know a lot of people are going to be interested in trying out this product to see how it can improve their oral health. I have absolutely been enjoying it myself. And as a quick little reminder, you can always get my free guides linked down in the show notes, the guide to using blue blockers, as well as the guide to building your perfect quantum day for optimal circadian health. As a listener of the show, you can also always save 10% on any of my courses if you do want to dive deeper into any of these topics. That will be linked down in the show notes for you, and you just use that code podcast to save 10%. Again, if you're enjoying today's episode, leave us a comment underneath this video and hit that like button. It will help to get the show out to more people. And of course, hit the share button. Send it to a friend, a family member, or share it in a group that you're a part of if you think that this information will help impact their health in a positive way. Thank you so much for listening, and let's get back into the show.
And then the final bit about the UV is that one of the main contributors to periodontal disease, so gum disease, gingivitis, the whole spectrum of conditions, is a bacteria called Porphyromonas gingivalis, P. gingivalis. And this is typically found in people who have, extensive gum disease. And we know that UV light in this range is shown in the wider photobiomodulation literature to actually snap the tails off these little blighters so that they're just not as motile, they don't work as well, and therefore you tip the balance in favor of a more friendly, bacterial population in the mouth.
I think, when I'm at dental school, I get taught, fluoride, mouthwash, wipe out the oral microbiome, but something that's so good about the brush is, you're targeting not just all of bacteria, but, you're targeting bad bacteria. So you're improving that oral microbiome. You're not just, nuking
wiping
the whole mouthwash. So it is really interesting.
Yeah, it's got me thinking, there's so much literature on red light therapy and impacting the gut microbiome positively, giving it more diversity. I've just anecdotally had a lot of clients and myself using red light therapy on the gut. It makes me wonder about how it could impact the mouth. I don't know if there's, like I said, there's 6,000 plus studies on red light therapy. So I don't know, you would probably be more adept at that information, but it just kind of makes you think if it can do that in the gut, and the gut is, the mouth is kind of the pathway to the gut, the correlation between the two, right?
Yeah, and it's sort of the gateway, isn't it? And it's a different environment, and at some point transitions from more of an aerobic to an anaerobic environment in the gut, and it's exposed to more light than the gut. So it's there must be a transition at some stage, but most of the literature is trying to be very functional. We're using it to try and treat this condition. But there is literature around, stem cell generation in the pulp tissue, but also the periodontal ligament. So that's like the little trampoline sling that holds the tooth in the bone, essentially. And that's what it gives it the proprioception to be able to feel a hair between your teeth. So, there's some very, very delicate and sensitive tissues there, which are all sensitive to light. They've all got proteins in which are reading the light in our environment, and responding to that in that sort of faster than what typical transgenerational stuff would have been expected. So this is the stuff which changes on a Jack would say a femto and attosecond basis. That information is coming through and shaping the way you deal with it with the base code of your genes. So there's a lot in there. There's a lot we still don't know, Sarah. The one thing we do know, it's super safe. You can happily use this and be comfortable with the fact that, well, what are the downsides? Well, there's virtually no downsides to using it. And so if it has any benefit, then that's even better. The one thing that we've thought about is, how long do people brush their teeth for on average? Well,
Yeah,
somewhere between
2-3 minutes.
2 or 3 minutes.
Supposed to do it for 2 minutes, right? That's the advice that the dentist always gives.
Yeah, I'm pretty sure my boys do it for about 30
seconds.
seconds.
I was going to say 30 seconds is most kids probably.
So there's a lot of variation there, and we know, and I heard your chat with Chris from EMR, and there's definitely a sweet spot from a light penetration and sort of time in treatment perspective. And I think one of the arguments you could have with a product like ours at the moment is, well, is 3 minutes enough to make a clinically significant difference or a noticeable difference? And the only thing I can say is that, I probably started from a different place to other people, in a sense. Someone taught me how to brush my teeth. We went to school and they showed us different techniques, and then I picked the one that worked best for me. Whereas I understand most people don't get that. So I was probably starting from a different place. But I find that like, if I used to get ulcers, I don't really get ulcers anymore. I have my oral hygiene regime is probably slightly different to what people expect, in the sense that I only brush once a day. I do use a water flosser because I had orthodontics as a kid, and teeth are tipped in a slightly different way than would be natural. So I've got some natural areas which need a little bit more cleaning. And then I do some oil pulling as well with coconut oil, that we put a bit of menthol in. So, that's a typical regime. So I only really expose myself to 3 minutes a day of this type of thing. And obviously the toothbrush is being moved around. So on each individual spot, they might only get sort of 15 to 20 seconds. But I'm still noticing a change. When you go away on holiday and you're like, oh, I just got my manual toothbrush, things feel different. So, I certainly feel like that. And the nice thing that we wanted to develop with the brush is that you can use it as a brush, but you can also use it as like a light wand, essentially. So the bristles actually come out of the brush, and you can be in a position where you can use it to just overlay on the tissue, essentially. And at the moment, there's a centimeter or so of bristle in there, which separates you from the light source. But you can take it out, and it's one of the things that we wanted to give a nod to sustainability, in the sense that that's the only bit that is disposable. So the rest of the brush is all one piece. And I don't know if you can see, but that's the LED array just in there. And so you can take these off, and because it's all waterproof, then you can just lay that directly on the tissue inside your mouth if there's an ulcer, and you can get direct relief. As Chris said, it's almost instant,
immediate pain relief. Definitely.
Wow.
Yeah. And you can use that like people would use topical anesthetic or creams and things to try and do it. So it does give it a bit of versatility as well.
Interesting. Yeah. And I know that people would ask that. So I buy this toothbrush, what do I do with the head? So they would just continue to replace that however often, every month or so, you think?
But 3 months probably. It depends on your technique and the pressure you use when you brush, because in theory you only need finger and thumb weight to be able to exert enough pressure. But of course, everybody white knuckles it, and go exactly. So this, it is the bristles are really soft on purpose, because that's, you don't want trauma. You don't want to be, scraping and damaging the gums, because then you get issues with, leaky gums, which is just an extrapolation of leaky gut.
Yeah.
So I'd love to hear about flossing too, because you said you use the water. So, and I know a lot of my dentists always, you need to floss. And how do you feel about flossing?
I mean, I think everybody does it badly. So you're more likely to cause problems with trauma if you experience the same.
I think, in dental school, we get taught, even now, so we get taught to tell patients not to floss and to use interdental sticks, like the little interdental brushes instead. And I think, well, if that's coming from the dental school, which isn't, aware of all this movement in the dental world, then there must be some fundamental issue with flossing. And I know like a lot of biological dentists talk about how, for a lot of people, if their teeth are in the right occlusion, then you don't really need to floss, and it's going to cause more trauma than without. And if you're flossing and you're causing bleeding in the gingiva, then you're opening up and exposing yourself to different bacteria, and that's just going to cause an inflammatory response. I know when I was on my journey, it was all about leaky gut, and there's this big thing about intestinal permeability, but we don't think about it in our mouths. If you floss and your gums bleed, most people don't even think about it. They just spit out and wash their mouth and just think that's normal. So I definitely think it's probably not recommended unless you've got a lot of dental work.
Yeah, I think that's the key bit. Certainly from my perspective, I don't have any fillings that involve the side of the teeth.
Yeah.
So the only variation I've got is from orthodontic work. So teeth have been tipped a little bit and not quite in the ideal occlusion. But I think if you've got crowns, if you've got fillings that involve the side of the teeth, I think there is a stronger argument for that interdental cleaning approach. But with floss, people just, they saw with it, they do all sorts, stabbing the gum, and, it can look like a butcher's shop sometimes. So it's a case of being
mindful.
Yeah. Being sensible. I like the water flossers because I feel that they're relatively a gentle interdental approach. I don't really like the sticks and the brushes, just because they just seem traumatic to me. You're forcing the biggest brush you can get through a contact point, below the teeth. And I understand that that's important for some people with advanced periodontal disease, because it's the only way they can get to those areas. But for the majority of young people, we would expect the gum margins to be tighter. And so it just seems a bit much to do that. So the water flossers will go a millimeter or two below the gingival margin, so into that little crevice where the free gingiva becomes attached to the tooth with the cementum. So they'll flush that area out, and as long as we're not dealing with extensive disease, then I think you're good with that. And it's water as well, so I just quite like the idea of doing it with that.
I think there's a few companies now that are using water flossers, but combining it with ozone as well, which is quite. But you've got to think at the end of the day, the body knows what to do. We've just got to supply it with what it wants, and it will do the work for you, really.
Absolutely. I'm curious about, I guess, toothpaste and the brush. Do you advise a specific type, or do you advise no toothpaste, or what are your thoughts on that?
I think toothpaste often serves as a lubricant when you're brushing your teeth. And certainly, like when I was poorly, I was on additional fluoride strength toothpaste. You just realize the mistakes you've made in the past. But I also grew up in two areas in the north of England which are naturally fluoridated. So, that was my background anyway. I probably have a fairly high fluoride burden even now in my 40s, even though I haven't used it for 5 or 6 years. And there's definitely a balance you can make with iodine to balance that. But my family don't use fluoride toothpaste. My kids don't use fluoride. And that's partly because, we are pretty on it in terms of their diet and what they're eating, and seasonal stuff, Sarah, they have the odd, what they would class as a treat, but it's like 85% dark chocolate. So, it's there. They just don't have regular sugar attacks. So I don't feel for them there's any risk benefit balance in favor of fluoride. There are some of my patients that I treat through the NHS that are coming from a very different perspective. They've maybe already lost a number of teeth at the age of 12 through dental decay.
Wow. And
some of them may not have the support to make the changes that at that age that they would need to make. And some of them just don't want to make the changes, even with the support. So I think in that environment, there probably is still a an argument for the strengthening effect of that enamel through fluoride, but I don't think you should need it. It's just from a social and implementation point of view, there is still a place for it, in what I talk to patients about, because we're trying to provide individual care. And I know what the Holy Grail is for them, but they're 10 or 11 or 100 points away from that. So you've got to make certain concessions sometimes. So there's no toothpaste that we specifically recommend. We are actually looking at toothpaste, and there's a couple that I like. I like the look of, and it's just sort of finding the way, understanding about hydroxyapatite as a.
That's what I use one of those. Yeah.
Yeah, and I think biologically that makes a lot of sense, in the sense that that's what's in your teeth anyway. So rather than changing the structure of that to fluor hydroxyapatite with the incorporation of fluoride, well, can we just bathe it in the hydroxyapatite itself? There is a little bit of literature on the flip side of that, or how safe is it to use those things. I just don't think there's enough information for me to make a decision about that just yet. So I just tend to go fairly basic, and use it. In my mind, it's more of a lubricant when you're brushing your teeth, and a sort of a flavoring, essentially. So you get that, because everyone likes that minty freshness after they brush the
definitely.
So
what I've heard from another dentist never to use, because I know Redmond's has like a charcoal toothpaste, and I've heard that that's like a big no-no, because I think a lot of people get into alternative health and they think, oh, I know this, the regular toothpaste is no good. Like, this has got to be no good. And the Listerine and just kind of wiping everything out, that's probably not a good idea. But then they look at like a charcoal toothpaste and think that's a good alternative. But I've heard that's not maybe the best thing for teeth. What's your opinion on that?
I honestly have never really looked into it. I tried it once and it really upset my gut. So that was just a very easy decision for me to make, not to go down that line.
I think charcoal's used for a lot of detoxification. It can pull a lot of things out, and I think for a few patients, they've got a lot of amalgam fillings. You can sometimes have to be careful with things like that charcoal, because it can pull certain heavy metals out, and if you're not at the point where you're ready to detox properly, using something like charcoal can cause it. There's also the argument of it being quite abrasive for the enamel as well.
That's what I heard. It would break down the enamel of your teeth. Yeah.
But there are mixed views on it. I think a lot of biological dentists are experimenting with it at the moment as well. So it's definitely something to look into.
Yeah.
Interesting. Yeah. It's one of those things that, like I said, people know that probably it's not the best idea to. Well, actually, I don't know if people do know if you've mentioned it, Flynn, about the microbiome in the mouth and people using these kind of like Listerine or types of things that just wipe out all the good bacteria in the mouth. Why is that not a good thing? Just for anybody who's listening and is like, I've never heard of that before. Why should we not use those things in our mouth?
Well, I think, there's over 700 different species of bacteria in the mouth, and, there's a lot of bacteria that we just don't even understand, what their function is and why they're there. And I think, if you're not like at a healthy place metabolically and you're wiping out your microbiome, 2-3 times a day, that if you're just wiping out a clean slate, then you're not giving chance for your microbiome to stabilize and, affect itself basically, and you can have an increase of what we class as bad bacteria.
It leaves a void essentially, and then it's just first come first serve to the table. So you don't really know the impact of that. What's going to take a foothold? Is it going to be a naturally occurring fungus in the mouth? Is that going to all of a sudden give you a candidal infection, which is visible? Never mind, sore and you're uncomfortable. So disrupting that, I certainly don't know enough about the oral microbiome to be able to tell you what all of those species do. And so, that sort of precautionary principle, well, first, do no harm to that. And then if we're providing the right ingredients, then we should find that there's a correction of any dysbiosis that's there. And then you can build on that, and that's really related to soft tissues, but they coat the hard tissues of the mouth, the interaction with the saliva. We haven't talked about the saliva, but
let's talk about that.
Saliva is almost exclusively water and minerals. And Jack has he sort of made me aware of an idea of how the parotid gland interacts with the mouth, and how it's this gland which has local effects in that, it can sense what you're going to eat, and so it can prepare the enzymes in your mouth to start that pre-digestion phase that occurs during mastication and before you swallow. And then it also has an effect down to the pancreas, to the islet cells, saying carbohydrates on the way, we need to do that. And that's why you see a spike in insulin production potentially before you've even ingested the meal. So this sort of connection that I think it was a chap called John Leonora, forgive me if I've mispronounced his name, but talked about this, hypothalamic parotid axis. And obviously you've got other salivary ducts and glands in your mouth, and they're pumping this saliva mainly during the day. You see a downturn on a nighttime because it exhibits a nice circadian profile. Mastication increases that, and all that saliva is water. And we know the impact of the microbiome in terms of producing light. Bacteria produce 5,000 times more light than a eukaryote cell does. So you've got an environment which has got a mass of water, it's got a mass of prokaryotes, okay, and then you've got this complex interaction with the exterior environment, because we're opening our mouths and talking and eating food and things, so you're getting external light sources in as well. And I mean, it's just a melee of things which can work in synergy and harmony when the right environment is there. So what impact does light in the red range have on the water in your saliva? Well, is it growing an exclusion zone? Is that giving you the pellicle, which is like a protective bubble wrap over the teeth that you can't really see, but it stops them being worn? Is then UV light expanding that that exclusion zone that's there? And how that all interacts. Nobody's looking at that yet, Sarah.
No,
but it's all there, and it's quite. I know it's quite nerdy, but it's quite exciting as well. That in that small area, you've got the interaction of all of these features, and then Jack drops the bomb of POMC, and well, what's the role of melanin in that, and the charge separation and that whole angle. It really does just blow your mind what we don't know about that whole interaction. But in my mind, it all works in the same direction and in synergy. So the brush for me fits well into that. No matter how you angle the story, I think it only strengthens that relationship.
Absolutely. I think I didn't even think about that, because we think about, well, actually, most people have no idea about exclusion zone water to begin with in the body and how powerful it is. But then you think about the saliva. I mean, that's obviously a source of water in the body. And so thinking about the implications of a light that you could use in the mouth to potentially strengthen that exclusion zone water in the mouth, which could, I mean, it's just so powerful that it's a communication process, right, in the body, that we're stuck on this like biochemical model. And I just kind of spent all your time talking about this toothpaste or this floor, and the body is so much smarter than that, right? Like it's got such a more self, as both of you have experienced on your own health journeys, it has more of a self-healing mechanism if we can provide it with the correct signals. It's all about the signals that we give the body. The light through the eyes, and then also light that shines on the body is huge, right?
Yeah. And a beautiful example goes back to that John Leonora stuff, because he was talking about this axis with the, the brain and the parotid and the pancreas, and, how that was all interacting and preparing. But one of the other things he showed, that dependent on the, I think he was looking at sucrose, and dependent on the sucrose content of the diet the teeth were exposed to, what he found is that he put like dye in the mouth, and he wanted to see whether the diet had an impact on how this dye was either kept out of the tooth or pulled into the tooth. And the idea behind that was, well, he had this concept of tooth decay, being that in those little dentinal tubules that I described earlier, running through that middle bit of the tooth, the dentine, there's a flow of liquid, of water or whatever they're filled with. And the flow in health is outwards. So from the center of the tooth outwards, so that essentially any nutrients that are coming into the root of the tooth and into the pulp chamber where that nerve and blood supply live, can then be integrated in those avascular structures. So it's taking that nutrient, and that allows a tooth to heal and produce what's called secondary dentine, which is, if there's a damage on the outside, your tooth will lay down more tooth tissue on the inside to keep the distance the same. So it's got that buffer. And so in health, that flow is outwards. And what he found was that when he changed the diet and went towards a higher sugar diet, it actually flipped the flow in the tubules. So instead of flowing from in to out, the flow in the tubules was out to in. And this ingress is what he felt caused problems with inflammation in the nerve of the tooth, and also allowed the transmission of, acids or bacteria or whatever into the tooth to cause tooth decay, which is almost heresy if you were to suggest that as a how tooth decay is formed. But all of a sudden, when you start to understand about resonance and flow and all this, well, maybe he's onto something. And if you think about when teeth become really diseased, well, the focus of that infection is drawn to the very root of the tooth. It's almost like it's all being pushed down to the very end. And so even from a pure mechanics, that change in flow from in to out and then reversing it, that sort of fits with a lot of the pathology that we see, in teeth. And that different environment has vastly changed the way that tooth's able to cope. So, I mean, that's just the beauty of biology or whatever underpins that, whether it's physics or whatever.
Yeah. Just the whole kind of foundational idea that our body is meant to be more of a self-healing organism. And we're so quick to throw suppressive therapies and suppressive medications and antibiotics and things like this, which I think there are times when these things can save lives and it's important. But for a lot of people, they are overused, and then they never kind of entered this world of quantum biology and allow for the body to be in this, improve the redox function of the body and watch things change for the better, Yeah. Yeah.
I think it's the illusion, and it may be an illusion, but the illusion that you can impact what's wrong with you. It's very easy to feel like you're in a medical system and you just have stuff done to you, and you just you turn up for your appointment and they do something else, and then you see if that works, and then you go back and they do something else and you see if that works, or they give you some tablets for you to take at home, but you don't know how they work and you don't know what the wider impact of that is. And I think just the thing that the whole concept of quantum biology has given me is the empowerment that I actually can have some control.
Help yourself.
Yeah, over myself, but I can help my kids. You know,
Yes.
I can give them a better start. You know, than maybe some of their peers who aren't receptive to that. And you know, I might be kidding myself, but at the same time, that's really valuable. You know, having that that control. I can make some changes. I can do this. I can make a choice about this. It's very, very empowering.
Absolutely. I love it. Well, I know everyone that's watching or listening is going to wonder where they can get the brush from, how they can find out more information. So what should I tell them?
I think maybe start on our Instagram. Our Instagram is Bristol, BRISTL UK. And then I think, you know, there's a bit of information on different, you know, oral health conditions and how different wavelengths like the 635 and the 410 can support these. And then also the link to our websites. We have like a, you know, a US website and then also like a more non-US worldwide. But we'll send you the links, I'm sure.
Yes, please do.
Yeah,
I'll make sure I put them in the show notes for everyone.
Yeah, from a delivery perspective, it's sort of set up so there's a US ordering point, and then there's a everywhere else. So,
okay.
I know it's weird the way that's set up, but it's just how it's worked. So yeah, we'll try and make sure that that's clear in with the information we send you, Sarah.
Fantastic. Well, this has really been wonderful, and we're definitely going to have to talk again as your product continues to develop and you continue to learn more things. So thank you so much for being here today.
Pleasure.
No, that's great. Nice to meet you, Sarah.
Nice to meet you as well.